Well, good afternoon. My name is Marty Guthmiller. I am the CEO at Orange City Area Health System, bringing you on this Thursday afternoon, October 15, the 64th edition of our COVID-19 community briefings. I'm going to start right away with the numbers in Sioux County. As of just a few minutes ago, again on October 15, from the coronavirus.iowa.gov website. Again, you can follow that website on a daily basis and keep track of things on your own if you want more detail than what I provide. Sioux County has 2,200 positives now of the 8,946 tested. That's a positivity rate of 24.6% compared to 24.1% the time before and 23.4% the time before that. So our rate continues to climb in Sioux County, a plus 90 since Monday in terms of positives. A number we're also following very closely in Sioux County is the 14-day average. Unfortunately, we are now number one again in the state at 26.5%. We had been at 25.1%. And prior to that was 23.4%. And so Sioux County, again, number one in the state at 26.5%. Lyon County is number 8 at 20.3%, down from 25.6%. Plymouth County remains at number 10. They were at number 10 at 18.8%. They were 17.7%. So they did jump 1.1% as well. O'Brien County dropped down to number 16 at 16.4%, but did not drop off much from a percentage as they were at 16.6% previously. Also a number that's going up is the number of counties 10% or higher, and that is 55 as of today. So over half of our counties in the state of Iowa are 10% or higher in terms of positivity rate. That number last time we spoke on Monday was 51. Region 3, again, not good numbers there. Region 3 hospitalizations are now 125 hospitalized in the 20 counties in Northwest Iowa. That number on Monday was 115, so we grew 10 spots this week. 25 people in the ICU in those 20 counties. The majority would be in Sioux City. That number was 26 on Monday. There were 17 patients admitted in the last 24 hours. Looking at this from a state basis, we have 103,432 positives in the state of Iowa. That's plus 3,256 since Monday. We've tested 880,916 Iowans. Or people, I guess would be better, more accurate. That is a 11.7% positive rate. Continues to climb. That number previously was 11.6, the time before that 11.4, and the time before that 11.3. So again, it takes a fair amount to make the number go up when you have a denominator of 880,000. So it is climbing. So you know our positivity rate is significant. The number of folks hospitalized in the state of Iowa is 437. I didn't have the number from previous. That number was 414 previously. So we have jumped from 414 to 437 this week. 21 Sioux County residents are hospitalized. And that currently is tied for 4th in the state. Again, 21 Sioux County residents hospitalized, most probably in Sioux County, but could be hospitalized anywhere. O'Brien County was at 9 as of today, Lyon County 2, Plymouth County 6, Woodbury County 33, and Polk County 39. Polk County is now number 1 in the state. Woodbury County is now number 2 in the state. Looking The number in Woodbury County was 48 on Monday. So they did drop significantly from 48 to 33. So that is a good change. Polk went from 38 to 39. So they didn't do a lot to move into the number one, but they did enough, I guess. So that's where we are. There's no doubt we're in outbreak status. Numbers are going up, not only locally, but in the state as well. Number of deaths are also going up. We've had 36 more deaths since Monday. Sioux County now has officially 11 deaths. That number was 8 on Monday. Again, as I look at the demographics, we're not seeing anything change. Still 89% in the 61 and above category. So just not much else to say there other than the numbers are too many and they continue to climb a little bit. I'm going to shift here into locally a little bit and get a little more detail in terms of what's going on locally. I think it's important for you to understand exactly what the environment is, exactly what our healthcare system is battling, and probably more importantly, what our healthcare workers are battling. As of this morning, we had 18 patients in-house, 18 inpatients in Orange City. 10 of those 18 were COVID. So more than half, 10 out of 18. Our emergency room is seeing about 15 patients a day, roughly, and approximately half of those patients are COVID related. We'll talk a little bit more about the other half because things keep going on. Of course, there's more to life right now than COVID, and sometimes it's hard for us to see through that fog. Landsmere, as many of you probably know, Landsmere Ridge is currently closed to visitors. Tenants are largely restricted to their apartments. Food is brought into them. We have 10 positive tenants currently at Landsmere Ridge. 4 of those folks are hospitalized. Prairie Ridge, we continue to test all residents weekly. In fact, today was our testing day out there. Very pleased to report that we had 0 positive residents today at Prairie Ridge, and that's been that way for quite a while now, and we want to keep it that way. We've had a couple staff positives, but we've been able to isolate those. Those folks get better, come back, but fortunately we've been able to keep our residents healthy. And again, as of today, just a fact, a few minutes ago, I learned that the entire resident base at Prairie Ridge is COVID-free. So great news there. We are currently well stocked in our tests, and so that has freed up significantly. And so we have a great deal more of rapid tests. We of course have the Test Iowa clinic also, if you want to just be tested regardless. That is 7 a.m. to 9 a.m. Monday through Friday. Our occupational health department, just go to testiowa.com and you'll find your way to Orange City there and fill out some information and you can get that test. That is a PCR test and that's available if you would like that. I alluded to this a little bit earlier in terms of our ER visits. You know, emergencies don't stop just because of COVID, and neither do we. We ask that you don't delay care for things that are serious, like heart attacks, strokes, falls, and any other serious injury. We'll continue fighting COVID-19, and all our team members and patients have everything here that we need to stay safe. So please don't delay on those other things that in many cases could be harder on you than COVID. Finally, ask you not to forget those preventative measures also that are very important to your health. Things like getting your flu shot, having your children vaccinated appropriately and in accordance with normal schedules, colonoscopies, the other various screenings. There is some indication out there, generally speaking, that cancer diagnoses are down. Well, most likely that's not because cancer is down. It's most likely that people simply aren't being checked. So please don't delay on things. Keep your screenings up to date, and prevent those unnecessary things from happening down the road. We don't want to get so consumed with COVID that we ignore the other risk factors in our life. So again, please pay attention to those preventative measures. That's going to be it for the week. I continue to think about providing once a week briefings. So it's kind of a shout out that I'm thinking about that. But stuff's happening so quickly right now that we want to make sure you have all the information that you need and that you want. And so we'll plan to come back on Monday with new information from the weekend. And we'll also have the local scoreboard. And we hope to see numbers down a little bit on Monday. So have a great weekend. Stay strong, stay vigilant. Keep doing those things that we've asked you to do. Mask, social distance, hand hygiene. Again, it's not rocket science, and you could all probably give this report better than I at this point. But please stay vigilant. Please keep doing those things. And above all else, stay healthy. So thank you again for joining us, and we'll see you next week. Thank you.